There was a complete failure to report what the health and social care bill was about and what was at stake for the public.
Some doctors have tried to tell me that the media are allowing to go unchallenged negative stories about the NHS, originating, they say, from the Department of Health and health ministers. The British Household Survey of 2010 showed the highest ever satisfaction with the NHS.
By not telling the whole story, only the negative one, we create a kind of bad propaganda. By not reporting the whole story, the media have not been reporting the good. They have not been keeping the records straight. The Commonwealth Fund, for example, a non-partisan US research organization, found the NHS to be the best in the developed world, and the US, the model to which our politicians now aspire, the worst.
And some pretty senior doctors have complained to me that no distinction is made when the service failure is provided by private provider companies, for example night GP cover and the private breast implant scandal.
Why is it that the media is no longer representing the public interest?
The media are bottom feeders. They need to create a story. Constant flux is a story, but they're never really concentrating on the quality of care. They don't understand it. They're never really interested in the patient. They're interested in political machinations, Punch and Judy. And that's how the media work.
And they're not being paid to do the sorts of investigative journalism that there might have been 20 or 30 years ago.
In fact, they don't actually have any sources inside the hospitals often. And it's difficult because newspapers have no resources. These stories can be legally complex. You can have patients who've really suffered, doctors who've really suffered.
I've been working abroad for quite some time. And before I went away, the image I have of the NHS in the media is about angels. The nurses that are selfless and work so hard and make us well, and they care about us and look after us. And then I go abroad for a decade and a half, delivering medical services overseas, and when I come back, the way the NHS is portrayed in the media is very, very different. Suddenly it's catastrophe after catastrophe, and every initiative that is put forward somehow seems to have the effect of further privatising the system.